Hi, this is Tom and I'm reporting for School Aid, a brand new medical centre in Nyalanya. And I'm going to meet the staff here so they can tell me more about the place.
We are at Nyalanya Community Health Centre. This health centre was initiated by the community members because of the fact that the other health facilities are quite far from where we are. So this health centre is an initiative that is meant to cut down the distance that the community used to travel. It serves about 200,000 people today because of the proximity of the health center. World Vision has been a supporter of this initiative, and World Vision has done quite a bit of the structures that are here. There are rooms for counseling. When patients are here, the patients are taken for counseling before they are tested. It is just important to be able to counsel people, to let them know really what are they going into, so that they are not shocked, or you minimize anxiety during testing.
This room is for HIV counseling and testing. When the counseling session takes 45 minutes or even an hour, at times they come in couples, at times an individual comes. But if we have a client, after being counseled, now we leave the client to decide either to be tested or not to be tested. By now we don't have drugs. We only provide VCT services only. And we hope in future God will help us and get drugs to our clients. Also, as we have seen, the most affected age, as whatever our tests prove, we find that the young people are very much affected, especially adults from 18 years to 27 there. The rate is so much high. After being tested and you get your results, we find that our youths, mostly who are affected, they tell us that they now want to change their behaviors. They don't want to have the kind of life they were leading before because they didn't know. But after bringing the site here and coming for their counseling and testing, they've seen that it is important to lead a new life now.
Does HIV/AIDS affect the children who go to school here?
Very much. Very much, because you find maybe a young girl of 17 years. Yeah. Now, with those ones, we call them mature minors. But when you test them, you're even afraid they turn to be positive. So that's why I was telling you that the most affected age here that we find is as from 18 and 20s there. And you find mostly there is school-going age to some. Yeah.
And are there a lot of orphans affected by HIV who go to school?
The orphans are also affected in that maybe if they don't have education facilities like books. So it makes them even feel demoralized to going to schools. Because if you want to go to school and you are told you have to come with these textbooks, you are needed with new uniforms, such like things. But you don't have them. So the child will feel that today I'm not going to school, I'm going to labor somewhere so that I will get money and go back to school. So you find such frustrations that our children are facing. Makes their education to be so high. And by so doing, then we find that the child is now turning to be a street boy, just because there's no one to take care of. The orphans are now looking gloomy, just because there's nothing to make them happy. Yeah, it's bad. I would say it's very bad, because we find that even if the parents have died, some children are not told that that is your parent who is there. The relatives or the people catering for the funeral would like to maybe to hide the children, thinking that the child will even cry more that he or she wants the parents. And you find that you'll be told, oh, your mother went to America, she will come back. And this child, whatever the people in the community are forgetting is that this child is still growing. And by the way the child is growing, the child will tell you, I want my mama. You told me my mom went to America. But why is not my mom coming back? Yeah. Now you tell them, no, America is very far, your mom went for further studies. But you're forgetting that this child is growing and his brain is now widening up. Yeah. Yeah, suppose it is an auntie. It will bring a grudge between the auntie and the child. Yeah. Because the child grows, he or she will understand from other people, even the neighbors, the relatives, that no, your mom died. Now, if that child goes to the aunt and asks the aunt, you told me my mom went to America, but I'm made to understand that my mom died and that is the grave of my mom. So you see, it is very, very bad to our orphans. Whatever our orphans are experiencing is very, very hard. They are having hard time. So, and even it forces us to go outside there and help. Let us tell the child the truth. We should not hide the truth from the children.
I've just been talking to Hilda, who's a worker here at this brand new medical centre, and she's been telling me how orphans are very badly affected by AIDS and how this affects their lives. They cannot go to school because they have to try and raise money for their families, look after their families, and in some cases they're like 10 and 11 years old, having to look after their younger siblings. And I mean, that was a heartbreaking thing for me to know they can't have a life at such a young age. And then even if they want to go to school, they have to still raise money to get school uniforms and pay for books, which, you know, they haven't got a chance in life just through AIDS. And this medical centre helps, it gives parents tests so they know that whether they're positive or not, and it also helps them to live with the fact that they've got AIDS if they have, which kind of helps the children out, because if they've got it genetically as well, they know how to live, and it provides children an opportunity to kind of live a life and get an education and then carry on, get a decent job and earn some money and live happily, which, you know, it's hard to think that I could be at my age living here without any parents, having to look after my younger sister and work on the streets trying to raise money. That's a heartbreaking thing for me.